Hello, I'm Dr. Jennifer Klemp. I'm a professor of medicine in the Division of Medical Oncology at the University of Kansas Cancer Center. I'm also a co-program leader for our Cancer Prevention and Control program, and I'm our Director of Cancer Survivorship. And today I'm going to give you just a quick highlight of the 2021 ASCO Survivorship abstracts that were, I think, interesting or innovative, and will be covered in more detail as part of the ASCO Direct series. So a couple of the abstracts that I chose to cover deal with some late and long-term effects that are very common for cancer survivors. And in particular, one of the first abstracts had to do with sexual health in cancer survivors. And there was a group that looked at over 57,000 cancer survivors that came to their center as well as kind of all their outreach and satellite clinics. And they used a formal distress screener, which focused on sexual health. And they found that about 24% of the cancer survivors actually reported some sort of sexual health, lack of interest, or some sort of distress over sexual function, sexual health. And interestingly, there were some sort of things that they also found that were kind of commonalities. One is that patients who were seen in particular clinics like psycho-oncology or palliative care did tend to report higher levels of sexual concerns with sexual health. Also, those patients who had comorbid anxiety or depression had about 2 times as likely of to report that they had sexual concerns, and then men more than women. So I think it gives us an opportunity that from a large data set where about 25% of these patients did report concerns, we need to be thinking about how we incorporate this into our regular assessment and follow-up so that we can manage those concerns that are very important to our cancer survivors. Another topic that I think was interesting, and really one of the first times I've seen something kind of formally done at ASCO, had to do with the use of cannabidiol or CBD in cancer survivors. These investigators actually looked at using a national survey kind of disseminated by social media, and there were a little over 350 respondents who were mainly middle-aged white women who also had primarily breast or GYN cancers. And they asked them kind of, did you use any type of CBD product? Why did you use it? What was sort of the vehicle that you used? And so what they found was that quite a few people, are using some form of CBD, and the primary reasons that they're using it really had to do with pain, stress and anxiety, kind of managing some of those sort of late effects. But the other thing that I thought was also interesting is that there was a portion of patients who were using the CBD products for prevention or treatment of cancer, and that was about 14% respectively. So besides pain, sleep, anxiety, and kind of those common things that you would think of for the use of CBD, also was prevention and treatment of cancer, which is a little bit concerning since obviously we don't have data to support much of any of that yet. But what it does tell us is that we have this opportunity. And there was an NCI supplement out last year that hopefully will give us some insight as to how CBD is being used. Also, one of the findings from this study is that about 84% of the respondents said that they did get some benefit from the product they were using. And the most common was some sort of liquid, whether it be a drop or something or so forth. But there were obviously other ways, whether it be creams or tinctures or edibles that patients were using. So I think this is a concern, obviously, because we want patients to report all the things that they take, whether they be natural products or prescription medications. We don't know if the CBD products also included THC, which is really more of the psychoactive part of using cannabis. And so I think we have a lot to learn, and then how it sort of interacts potentially with some of the therapeutics that we would be recommending for our patients. So we have a lot of opportunities to explore that. And then the last kind of set of abstracts I wanted to just highlight for the ASCO 2021 Equity, every patient, every day, everywhere, I think has really a nice focus on genetics and genetic testing. Our group at the University of Kansas actually looked at a group of long-term survivors about 10 years from diagnosis who were seen in a breast cancer survivor clinic. We looked at over 2,000 patients. And what we were trying to assess was, did patients already have genetic testing? Did they need update testing? Or did they kind of now qualify for testing or somehow got missed along the way? I like to think our program has, a good process, but we can always improve, or we see patients, that come to us from other practices. So we have an opportunity in our survivor population. So from the 2,000 survivors that we saw, an additional 400 required update testing or initial testing. And of those 400 patients, a little over 11% had a pathogenic variant. So really important for us to be able to appropriately risk stratify them and then stratify appropriate screening and follow up for the patient, and offer obviously cascade testing to the family. So this is an important topic because genetic testing doesn't stop at the time of diagnosis. It actually needs to be sort of one of those things we keep thinking about. We update the family history. We ask those questions when they come in every time, and we identify more patients that do benefit from risk stratified testing to help them not only manage their screening, preventive strategies, and then obviously impacting the family, which is really important for a lot of our cancer survivors. And then the last was a special roundtable session that was hosted by Dr. Pierce, and it was actually right prior to ASCO, but it had a lot of the who's who in really discussing issues related to health equity, genetics, really an interesting roundtable on precision medicine. And I think it's worth a watch. It's available via YouTube, so you don't even have to log into your ASCO account if you have one of those. But what I found kind of the most interesting about that session and that roundtable had to do with how we define risk and sort of right size the playing field. And one of the things I took away from the roundtable and Dr. Fumio Balade from University of Chicago was really that genetics and getting patients tested, whether it be somatic testing, germline testing, whatever we're using for treatment planning and risk stratifying that patient, that's really a way to level set the playing field. So instead of really focusing on race or some of the other things that we know are barriers, such as race and ethnic minorities, any individual who's from low income or poverty level, regardless of race, and those who are uninsured or underinsured, those are already very known barriers that we should be actively dismantling and working towards. But could use of precision medicine really level the playing field? So we're looking at the patient and treatment planning and accessing resources based on what the genomic profile is, or the genetic profile, versus trying to identify these individual risks and work on a individual level. I think being able to use precision medicine as a tool across the board is really obviously hugely impactful. It's what I have spent the past decade of my career trying to do, is really bring things to the clinic, to the patient, and making that more accessible, because the only way that we can give the patients the right treatment at the right time is if we know that type of detailed information using genetic testing. So I will summarize that, it was a great virtual meeting, lots to see, over 5,000 abstracts. So this was just a little sort of nugget of I thought, interesting abstracts that were covered, as well as the Precision Medicine Roundtable on health equity. So hope you enjoy your professional development through ASCO, and thank you all for your time. Have a great day.